Chapter 20, The Mind Diet, in the book Youth to Elderly and Alzheimer's, narrated by the author Dr. Sanbar. The Mind Diet is actually made up of two diets. The first is the Med diet, or the Mediterranean diet, which was initially created to encourage heart health, and number two, DASH diet, which stands for Dietary Approaches to Stop Hypertension diet, which was designed to control high blood pressure and adult-onset diabetes. The Mind diet is designed to prevent or reduce dementia and the decline in brain health that usually occurs with age. By changing one's lifestyle and adhering to the Mind diet, it reduces the risk of Alzheimer's. In 1995, Wen Green and co-workers began studying the mental effects of the Mediterranean and DASH diets on 3,831 men and women, aged 65 and above, who were residents of Cache County, Utah. The cognitive function of the participants was assessed using the modified mini-mental state examination. After 11 years of follow-up, the authors reported that both the DASH and the Mediterranean dietary patterns were associated with consistently higher levels of cognitive function in elderly men and women. They also noted that whole grain, nuts, and legumes were positively associated with higher cognitive functions and may be core neuroprotective foods common to various healthy plant-centered diets. The Mind diet differs from the Mediterranean and DASH diets by the following. Number one, placing emphasis on berries over other fruits due to their antioxidant properties. Number two, highlighting the differences between green leafy vegetables and other vegetables, both of which are essential. And number three, eating fish at least once per week. Importantly, the Mind diet is effective when it is used in conjunction with other healthy habits like regular exercise, not smoking, and getting adequate sleep. There are certain factors that seem to increase Alzheimer's risk, and they are tied to a steeper memory decline. For instance, individuals that have some inflammation in the body during midlife are more likely to have dementia. Psychological distress also plays a significant role, and that was found in the Danish study. Even a slight rise in blood pressure might shrink young brains, and heart disease is present in many Alzheimer's patients. On the other hand, there are many factors that seem to lower the risk of Alzheimer's. These include youth, genetics, and family history. Those are not modifiable. Physical activity and exercise. Mental activity is essential. Brain training is fundamental to the maintenance of cognitive skills throughout life. It helps with attention, memory, problem-solving, reading, and psychosocial functioning. Some examples include crossword puzzles, games, reading, writing, cooking, and playing an instrument. Continued learning stimulates the brain, making people less susceptible to conditions like dementia. It keeps the mind sharp. So, join a book club, take classes at a local community college, or learn a new language. Higher education is vital too. Social activity is quite helpful. Having a good socio-economic status is helpful. Sleep gives the brain cells, the neurons, a break from recent activities and prepares the neurons for the next day. Sleep helps the brain to work faster and more accurately. It also improves memory, attention, and retention. Rocking motion, such as resting on a hammock or a rocking chair not only leads to better sleep, but also boosts memory consolidation during sleep. Meditation is associated with improvement in a variety of psychological areas, including stress, anxiety, depression, eating disorders, and cognitive function. It can also reduce blood pressure, pain response, stress hormone levels, and even cellular health. Meditation trains the brain in the elderly to be more attentive and mindful of tasks, and it can control memory loss and impaired concentration. Hyperbaric oxygen has been found to be helpful. Brain metabolism can be improved by treating Alzheimer's patients with oxygen in a hyperbaric chamber. It helps to keep some oxygen from fresh air and take occasional deep breaths. Smoking does not seem to be a very significant factor in harming patients with Alzheimer's. However, it is not recommended for elderly people who suffer from respiratory, heart, and vascular disease, diabetes, and obesity. Tea and coffee are not harmful either for Alzheimer's patients. In fact, caffeine is associated with a lower incidence of Alzheimer's. It may boost brain function, improve test of the cognitive function, and may also have a positive effect on long-term memory retention. However, taking caffeine at night may affect sleep. Wine or other alcoholic beverages are recommended by the MIND diet. 1 glass daily appears to be beneficial. Avoid excess alcohol, and care should be exercised when taking concomitantly sedative drugs like marijuana or opioids. Dietary supplements caution. In 2019, the Food and Drug Administration took action against 17 companies for illegally selling 58 products claiming to treat Alzheimer's disease. Those products were sold as dietary supplements, unapproved new drugs, and or misbranded drugs that claim to prevent, treat, or cure Alzheimer's. They may cause serious complications. The MIND diet recommends limiting the following 5 foods. Number 1, red meat. Limit consumption to no more than 4 servings a week to help protect brain health. Number 2, limit consumption of butter and margarine to no more than 4 servings a week to help protect brain health. Number 3, eat cheese no more than once a week if you want to reduce your risk of Alzheimer's. Number 4, limit pastries and sweets to no more than 5 treats per week. And number 5, limit fried foods and fast foods to no more than once a week for optimal brain health. The MIND diet favors the following. It emphasizes the natural foods that contain vitamins, flavonoids, antioxidants, and omega-3 fatty acids. Olive oil seems to be better than other cooking oil and fats. People who use olive oil as their primary source at home have greater protection against cognitive decline. Coconut oil would also be used. Eating green leafy vegetables at least 6 times a week and other vegetables at least once a day. Leafy vegetables include kale, spinach, collard, and broccoli. They are rich in nutrients that keep the brain healthy, such as vitamin K, lutein, folate, and beta-carotene. These nutrients in green leafy vegetables are linked to slower cognitive decline. Seniors who consume more than 2 servings of mushroom per week reduce their risk of mild cognitive impairment by 50%. Mushrooms are an essential source of ergothioneine, which may promote cognitive health. Flatulence could have fantastic health benefits. Human gas may have a foul odor from the hydrogen sulfide, but it may prevent dementia, diabetes, and heart disease according to recent studies. Eating nuts at least 5 times a week is important. Nuts are very important, in fact, for the brain. They are rich in vitamins and minerals, low in carbohydrates, and high in fiber, protein, and polyunsaturated fats. Almonds are native to the Middle East. They have the highest calcium content of all nuts. They are rich in antioxidants, fiber, vitamin E, phosphorus, and magnesium. They help in lowering the bad cholesterol, LDL cholesterol, blood pressure, and the risks of heart disease and diabetes. Brazil nuts are native to Guianas, Venezuela, Brazil, eastern Colombia, eastern Peru, and eastern Bolivia. They are rich in selenium. They help the immune, kidney, and thyroid functions and increase sperm motility. Cashews are native to northeastern Brazil. They contain oleic acid and unsaturated fat, which lowers triglycerides and raises the good cholesterol, the HDL cholesterol. They are rich in iron, magnesium, zinc, copper, phosphorus, manganese, and copper. They strengthen bones and promote general good health. Hazelnuts, or filberts, are native to North America, Europe, and Asia. They are rich in unsaturated fats and contain thiamine, folate, magnesium, calcium, and vitamin B and E. They help in maintaining cognition, healthy skin, hair, nails, and general good health. Macadamia nuts are native to Australia. They are rich in flavonoids that produce antioxidants. They have anti-inflammatory properties and promote heart health. Peanuts are legumes, not nuts. They are native to tropical South America. They are rich in folate, necessary for proper brain development and reducing the risk of birth defects. They can also improve memory and decrease depression and the risk of heart disease. Pecans are native to southern United States and northern Mexico. They contain polyphenols which act as antioxidants, and they also contain beta-cytosterol that help enlarge prostates. They are rich in manganese, which supports bone health and eases the symptoms of premenstrual syndrome. Walnuts are produced by any tree of the Juglans genus. They contain high amounts of antioxidants, phytosterols, that's plant cholesterol, and omega-3 fatty acids, which are polyunsaturated fats, omega-3 alpha-linolenic acid, which benefit the brain. Walnuts are rich in flavonoids and plant pigment anti-cancer compounds. Eating less than a handful daily improves performance on tests of memory, concentration, information processing speed, and ameliorates overall brain health. They also help with depression, Alzheimer's, and other age-related diseases. Eating beans more than 3 times every week. Eating whole grain, at least 3 servings every day. Eating poultry, at least twice a week. Eating berries, at least twice a week. Berries decrease the production of amyloid, which is the marker for Alzheimer's disease. In older women, cognitive decline may be delayed for up to 2.5 years by eating 2 or more servings of blueberries and strawberries weekly. Eat fish at least once a week. Fatty fish like salmon, mackerel, herring, lake trout, sardines, and albacore tuna are rich in omega-3 fatty acids, particularly docosahexaenoic enoid acid that's called DHA, which humans cannot synthesize. It is important for brain maintenance and function in Alzheimer's.